We have a few objectives that we're going to try to meet for you today. We want you to leave understanding the framework for bridges out of poverty. We want you to know where to find the tools and resources around using that framework and how to think about and apply using the Omaha System focus areas, which are part of Nightingale Notes by Champ Software inside a pathway to document the bridges out of poverty framework and the work that you're doing. Our speaker for today is Susie Johnson-Smith. Susie is from Ontario, Canada, and has 32 years of dedicated health and human service experience.
I truly can tell you all that Bridges Out of Poverty has changed my life in so many different ways, personally, professionally. It's had a profound impact on my service delivery, leadership, and my individual relationships, on a personal level. It also helped me to sort of understand myself better and have a language for my own upbringing, some of my own challenges and experiences, and see it through this Bridges lens. It was when I was overseeing staff training and development about 12 years ago that I brought in a trainer at Bridges Out of Poverty, like I am with you today. And I brought in that trainer from AHA process to facilitate a full day Bridges Out of Poverty workshop for our community. And I was so profoundly moved. I had been about 20 years in social work at that point. And I really just sort of sat there in complete awe, wondering where this framework had been for my entire career thus far. It began with Dr. Ruby Payne writing a framework for understanding poverty. She, is the founder of AHA Process, and she was an educator working in a high poverty school area and school district. And she wrote a framework for understanding poverty, which was about understanding economic class diversity and working with families who were experiencing instability. And from there, Phil Duvall and Terry Jersey Smith, just a few years later, were working in mental health and clinical dependency. And Terry was a nurse and Phil was the ED of an organization. They worked together and they read that framework for understanding poverty book that was aimed at educators. They read that book and they were so profoundly moved with the framework of understanding their patients better that they reached out and partnered with Dr. Ruby Payne to co-author Bridges Out of Poverty. And Bridges Out of Poverty is simply the original framework book, but adapted for health and human services, adapted for communities, adapted for professionals, advocates, peer support workers, health professionals like all of us, social workers, employers, landlords, any interested citizens in how to understand economic class and using the framework of understanding economic class differences and the challenges that each economic class has in navigating, society. And yet that most organizations operate typically from middle class norms and perspectives, which puts many of our under-resourced families at a disadvantage. And together, those two models are intended to support community well-being because now we're walking side by side with our patients and clients, as opposed to, like I said before, working maybe a little harder or kind of dragging people along or pushing from behind to try and build that future story. The work is based upon this social cognitive learning theory, which I'm sure many of you have heard about. This is the work of Dr. Albert Bandura, a Canadian psychologist who introduced this framework of understanding economic diversity, and also this framework of understanding how we all think, act, behave, prioritize, and make decisions uniquely different from one another. And so this starts to address when you hear folks say, or maybe even hear ourselves say, everybody knows that, insert whatever the statement is. Everybody knows you have to be on time. Everybody knows you don't show up for a job interview in a tube top. Everybody knows you don't answer the phone saying, yo, yo. So this cognitive framework introduces that we all think, act, behave differently and have a very different point of reference for our decision making. So this work is based upon the fact that Dr. Albert Bandura introduced that who raised us, whoever had the most influence over us, greatly influenced how we show up and how we think, act, and behave. And that's the top piece of the corner of the triangle, relationships and knowledge. Who raised us, had influence, and taught us information. whether that was your auntie, your grandma, foster care, temporary care, or one parent or both parents, whatever your story is and whatever anybody's story is that is, listening to this workshop, that we all think, act, and behave differently. So an example of this top piece of, the corner of the triangle is asking ourselves, do we ever sound like our caregiver? Do you ever sometimes repeat or find yourself thinking patterns in thinking or behaviors that come from your caregiver? Now, to be honest, sometimes I'm proud of that and sometimes I'm not. Now, equally important is the other cornerstones of the triangle. In addition to whoever had influence over you and raised you, equally important is the demands of your environment. And things like your basic needs being met. Maslow's hierarchy of needs, that first sort of piece of the demands of your environment, your safety, your sense of belonging, your food security, basic needs like housing, the demands of your environment. So I often think about my own relationship with food, for example, and how if you grow up with food insecurity in your household, it will influence how you think, act, and behave later in life about food. And so I find this social cognitive learning theory quite fascinating, to be honest, that anytime I think to myself, well, that's just common sense. This model has really challenged me and has challenged my own unconscious bias, because then I find myself kind of getting curious and thinking, well, common sense according to who? Is that my social cognitive learning theory that is relating to, the topic at hand? And what might that person's triangle be? How are they thinking, acting, behaving according to their upbringing, their environment, their demands, their resources? And it really has helped me to address any sort of unconscious bias that I may have been carrying about any of the folks that I was working with or coaching in a capacity of trying to stabilize as well. So I want you to think of your triangle and then also this economic line being continuous, not a clear-cut distinction. So there's no stereotyping or generalizing. It really is about thinking how we, can stabilize our environment with our access to resources. Situational poverty, more about something that happens that's financial in nature, that thrusts us into financial poverty, like the pandemic, like a health crisis, like a job loss, and you've worked in the same factory your whole life, a housing crisis, a fire, anything that can set us back in a significant way. It could even be our car breaking down and we're just sort of on the cusp of instability. Now, middle class simply means that our resources are stable enough that we can plan. When your resources are stable, you can think about future, because if we can be more self-aware around how we think, act, and behave as service providers and what our experience is with instability on this continuum, then we also are more open and more effective with folks who present differently than us. Now, there are 4 lenses, as you heard me mention. The individual lens is about improving relationships. Without relationships and engagement, we don't have patients showing up. We don't have client engagement in the case planning. Without relationships and trust, we understand that people don't show up, and that's one of our #1 barriers to providing services in the community. So institutional lens is about looking through the lens of our programs, our policies, our services as a whole. Are we matching the population we're serving, or are we offering more middle class lens programs? And I'll tell you, that was one of my very first aha moments after the individual lens and having those own internal aha moments and applying the tools at an individual level, then really looking through the lens of our programs and services, I recognized that we actually were not matching the population we were serving, and therefore we weren't getting the kind of outcomes we were looking for. So when we started to readjust our programs and services using the Bridges lens, we actually moved from an average 57% attendance to our workshops and programs to up in the 90s. We had 96% to our workshops and 92% to our one-on-ones. I had never seen that happen in my entire first 20 years of social work. Often wrap supports around our most vulnerable, truly collaborating, truly improving our cooperation to avoid the person having to repeat telling their story over and over again, and then ultimately improving our policy and our systems. And that's really the heart of the Bridges model. And this is the agenda for a full day workshop. The introduction material is some of what I've talked to you about today, really kind of introducing that social cognitive learning theory and the continuum of economic class. And then we dive into the 11 essential resources for stability. And in that one, we really look at how there's so much more than just financial resources that help us stabilize our environment and build a future story. And so this framework of 11 essential resources really looks at what's underneath some of the behavior that we might be missing. When someone seems non-compliant, unmotivated for change, what actually is really going on? So here's our model. Now it looks pretty daunting, but as you'll notice, it speaks to all four lenses the way I introduced in the very beginning. The individual lens is about providing Bridges Out of Poverty individual lens training to teach new tools, new understanding, and new approaches to our patients and clients, while equally supporting agencies in the community that run workshops called Getting Ahead in a Getting By World. And from there, that continues to build our collaboration, our common language, our critical mass of understanding, of helping to actually truly partner with our sectors in the community to collaborate and refer to one another to build those resources for our Getting Ahead graduates. That's the individual lens workshop. The institutional lens workshop then is all about ensuring our leadership are trained, our boards are trained, that we look at our policies, as I mentioned. We actually start to improve our engagement and therefore our outcomes and our key performance indicators. Many of us are struggling to get the outcomes that we need to get our funding, etc. And so this green, pillar really looks at how we can improve that. But we do need to start with the blue first, because if we don't understand ourselves and the folks that we are serving, at a real core, deep level, that old saying, the more reflective that we are, the more effective we are. So it really, that blue evokes self-awareness and self-reflection and self-management. And then the green helps us look through the window of our organization and actually match the population we're serving in our marketing material, our programs, our services, and our policies. And to be honest, it gives staff the best chance at helping our most vulnerable in the community. Now then, thirdly, we look at how do we get everybody at this planning table? How do we get leaders, decision makers, funders, and Getting Ahead graduates with our service providers in what we call a steering committee that uses that problem-solving thinking tool to address the barriers in our community? And it is a marathon, not a sprint. This is a whole philosophical approach to our service delivery. This is a movement of action towards community well-being, and health is instrumental in that. Our healthcare providers, health and human services is absolutely instrumental